vaccine production situation was somewhat different from many other countries. Okay, different in a sense from certainly from the United States, to some extent from Europe as well. And I'll tell you why. Ask yourself on what basis did India, this made in India vaccine, the larger one, Covid, on what basis was it being made in India? Okay, because it is a Oxford Group AstraZeneca vaccine. Okay, in that sense, it's a British, you could say, British designed product. Okay, now it was made in India because the owner of the vaccine saw India as a very efficient production venue. So along with that ability to make in India, the approvals to make in India, came an obligation to supply it to a large part of the world. Okay, so so the first thing people have to understand, it was not that the vaccine production started in India. It was invented by an Indian, owned by an Indian, produced by an Indian. It was a truly international collaboration. And when there is an international collaboration, if somebody gave you a vaccine to make in India, then obviously you have to do your part, otherwise it doesn't work. So that's your first point. Your second point was it also came with support from the COVAX initiative. So there was an obligation to support the COVAX initiative to give vaccines at low cost to a number of nations. The healthcare system stands exposed. Very clear that over 75 years we have underinvested in health. Maybe there were reasons. It's very easy to say today that you should have put in more money. I mean, I can now that I am in the government, and that too at a level where I see policies in other domains being made, I can tell you it's not as easy as it sounds. And this is not a defense of today's situation. I'm saying this over 75 years. And in fact, it is that realization which is why the Prime Minister was pushing for Ayushman Bharat. Because we had reached a stage where the Prime Minister genuinely believed that we cannot leave our people to the vagaries of the private practitioners, however good they may be. But having said that, you have what you have at this point of time, which is an underinvested health sector over many decades. Now, I can respond to this by saying, well, that's what I have, but that's not a good enough answer in a crisis. So in a crisis today, even though I have limitations, I have to make that extra effort, find some way by which I can respond to today's crisis. If somebody is sick, and somebody is looking for oxygen, and somebody is looking for remdesivir, they're not going to listen to policy explanations. They want to see practical answers on the ground. There's a huge demand for oxygen. Now, medical oxygen demand, so that people have a sense of the problem, has gone up from a little more over 1,000 metric tons consumption to something between 7,500 to 8,000. So you have a 7x, 8x increase in demand, and it's my obligation as government to meet it. I have to move heaven and earth, but I have to meet it in some way. And we are seeing, today, if you follow, for example, what's happening on the oxygen situation, that we've encouraged businesses to sort of change their production practices to free up oxygen, industrial oxygen, and convert it into medical oxygen. We're running trains. The Piyush Goyal ji is running oxygen expresses so that oxygen comes to the population centers, because the production centers are very distant. Even the tank, when you speak about health infrastructure, we had even oxygen tanker shortages, because if you look at the sort of the total fleet of India, it's really very small. I think there were about 1,200 tankers. Now we've tried to convert the nitrogen and argon tankers into oxygen tankers. We've been trying to purchase tankers from abroad and tanks from abroad. In fact, right now, that's really what my missions are doing. They are looking for oxygen cryogenic tanks. They're looking for, uh, for uh, for generators, for concentrators, and my effort. And the Indian Air Force is actually picking up empty tanks, flying them back so that we save driving time, so that we are able to get 2x, 3x performance out of the same set of assets. So there's a huge effort on out here. I grant you that it's a difficult crisis. It's a very painful crisis, but I can tell you that we are giving it everything we have and more.